the slides that I had are in your package, so I'll just go briefly over a couple of issues that we did. Who we are is the Accountable Care Transformation Leadership Team, and we are a group of CMOs, CNOs, Chief Quality Officers from Greater Cincinnati that meet on a regular basis. And we started as a health quality improvement project for Cincinnati. And we used the basic triad of quality, which is create a structure, use a process, and find an outcome. And we moved three major things, which were which were basically your core measures in three areas: acute MI, heart failure, and pneumonia. And we moved those very significantly from the 60% to the 90% range. So what we were able to prove is that we as a system, as a healthcare system, which is the Cincinnati healthcare system, Greater Cincinnati, can work together across different systems such as Christ Hospital, the Alliance at the time, University Hospital, Mercy's, TriHealth. We can all work together towards a goal and we can accomplish it. And this is my caution, is be careful not to be a failure because of the success measures you have. What we tried to prove is that we can move those measures thinking that those measures are actually an end to itself, and they are not. And the reason I'm saying this, and I know this is blasphemy to a lot of people, but if you look at our heart failure measures, if we are able to reach 92% of our core measures and accomplish those on every single patient, why do we have 23% readmissions? And that is why the transition of care is so important, because what we found out now, as we take on our new task, which is reduce readmissions by a specific number by the end of the year, is that it is not only about the clinical part, there's also the human factor, which we sometimes miss. So the patients that are coming back, they're coming back because they did not take the diuretic we gave them. And the reason they didn't take the diuretic we gave them is there's only one bathroom in a household of 6, and they're not gonna do that. They're not gonna have accidents all the time. Or they cannot afford the medication. We gave them instructions that they couldn't understand. We gave them labels on their medications that they couldn't read. So all of these things are really important. When they got to their primary care physician, they did not have any of the records from the hospital. When they went back to the ED had no idea that they were in another hospital, and on and on and on. So that is why the transitions of care are so important to what we are doing. And that's why measuring success is really important, but knowing what to measure that's really meaningful at the end is really important. So I'll leave us with that challenge, and be able, any questions for any of the panel, please. Okay. Enjoy your lunch, and please don't forget to fill your evaluation, and I appreciate it. Dora, any words of wisdom? Thank you.